Implementation of a pain assessment protocol at a nursing home facility, an evidence-based quality improvement process. Hi, my name is Loewenkamp. I am a Doctor of Nursing Practice student at St. Anthony College of Nursing, and I am working with your facility and Fiona to implement a quality improvement initiative that we hope will improve the pain outcomes in all of your residents. This initiative will involve all RNs and LPNs. So what is this all about? Research shows that assessing pain appropriately is necessary in optimizing pain management strategies. Although guidelines currently exist on assessing pain in older adults that cover a range of settings, they do not specifically focus on nursing homes. And as you know, there are numerous barriers to assessing, evaluating, and treating pain in an older adult, such as cognitive impairment. Another challenge you may have is lack of time. So understanding both your needs as well as the barriers you face when assessing pain is important to having a usable pain assessment protocol. So what if we were to provide you all with a simple and efficient pain assessment tool and implement a pain assessment protocol at your facility? And in doing so, we could decrease pain behaviors amongst your cognitively impaired residents. That is the goal of this project. I'd like to introduce the Abbey Pain Scale. Some of you may already be familiar with it. You should have received a handout that contains a link to a YouTube video instruction of how to use the pain assessment tool, as well as a hard copy of the pain assessment tool. The link is also provided on this PowerPoint. Please copy the link into a browser to open the video. Please take the time to view this short video. It may be helpful to have the hard copy of the pain assessment tool in hand as you view this video. The pain assessment scale has been validated for use in cognitively impaired older adults. It is a movement-based assessment, so please observe the patient while they are being moved, during wound care, or while bathing, etc. This scale should be used each shift to assess pain, and a reassessment of the pain should be done after any intervention is taken, then hourly until mild pain is achieved, then every 4 hours for 24 hours. I will ask you to document your pain assessments. Forms will be provided that can be completed for up to 10 assessments. You will be asked to date and time it, place the initials of your first and last name, the patient's BIM score, the score you get from using the Abbey Pain Scale. Please also state any other tool you use. For example, if you also used a 0 to 10 pain scale, please state that as well as the score and any interventions taken. On the back of the form, you will find the APS tool to use for your reference. Finally, please identify the pain as acute, chronic, or acute on chronic. You will see on the copies of the pain assessment forms I've provided that all the areas to be completed are highlighted. So before we begin implementing the APS tool and process, we need to make sure we iron out the kinks in using the tool. All staff on each shift will be validated using the tool and assessing a patient alongside Fiona. You'll both use the tool and compare scores. This may be done verbally or documented on the tool if you wish. By comparing scores, Fiona and staff can then discuss any discrepancies and teachback can be provided. Feedback from these assessments will be given to me by Fiona only for the purpose of providing further educational needs that are identified. So once validations have all been done, you will begin to use the tool on each shift. This will continue for 8 weeks, assessing all patients with a BIM score of 12 or less. And please remember to continue assessing and documenting on your patients as you normally would. At the conclusion of the project, we will repeat using the tool with Fiona by assessing concurrently as I've just described and comparing the scores. This will again help identify any future educational needs. You will then be invited to complete a very short paper survey. The survey will ask questions on the usability of the pain assessment tool and the feasibility of this process. Because overall, what I am hoping to find is a pain assessment tool that you all can realistically use a tool that works in your setting and also produce better pain outcomes for your patients. Finally, thank you all so much for your participation in this project. I know this is an addition to your already full plates, and I truly appreciate how busy you are. Please consider the satisfaction you will have knowing that you are making your patients more comfortable, and in doing so, this may increase the time you are able to spend in other parts of your job. Please feel free to reach out to me or Fiona at any point during this project with any feedback or concerns. Thank you again.